I'm Dr. Michael Hickman. I'm a consultant cardiologist in Guildford, uh, looking after patients in Surrey, Sussex, and the southeast of England. I have private medical practices based predominantly in Guildford. I practice out of the Guildford Nuffield Hospital. I practice out of Mount Alvernia Hospital and the Surrey Cardiovascular Clinic. I specialized in cardiology because I found it an extremely exciting and fast moving field. When I chose to specialize in cardiology nearly 30 years ago, the specialty had just developed coronary angioplasty and coronary stents were being released. We were moving forward with some interesting drugs at the time, such as statins. Over the course of the years, this has progressed dramatically. Our management of patients with coronary artery disease, with percutaneous coronary intervention, with arrhythmia, with a whole host of new medications, and with other cardiac rhythm disturbances using pacemakers, defibrillators, has all moved on rapidly. In addition to this, we are now able to implant percutaneous valves, particularly the aortic valve, and more recently there are a number of mitral valve and tricuspid valve interventions that have come to the field. And so this has been a fast-moving specialty which maintains a great deal of interest to us as clinicians. In addition to this, cardiology is a field in which one can make a dramatic difference to a patient's life. We might have a patient come to us who is in a life-threatening condition, and whether that may be a heart rhythm disturbance or an episode of heart failure, a myocardial infarction or a heart attack, and we can manage those conditions, often to give people a normal life expectancy. So it's a clinical specialty where we're able to make a great deal of difference, where there's been dramatic innovation over the last 25 years, and where we're able to really feel rewarded by the significant changes we can make to patients' lives. Cardiology, it is a wonderful specialty to be working in. We are daily. I see patients whose lives are blighted by cardiac conditions, and we have the technology, the pharmacology that allows us to diagnose, treat, and protect these patients. We can often take patients who are extremely unwell, and we can improve their clinical situation so that they can lead normal and full lives, frequently to a normal life expectancy. I've taken a significant interest in the last 4 to 5 years in early detection of heart disease. It is important with our patients that we try and also prevent major cardiac events that might be life-threatening. With early detection techniques, often using tests such as cardiac CT and using innovative AI models to understand cardiovascular risk and risk of myocardial infarction, we're able to intervene early with lifestyle measurement and other pharmacological interventions, or even if necessary, coronary stenting, to prevent a patient having a significant cardiac event such as a heart attack. Now, intervening early, I believe we can make a dramatic difference in patients' long-term well-being. We can avoid future unpleasant and high-risk cardiac events, and we can capitalize using these techniques on the major breakthroughs in pharmacology and coronary intervention that have become available in the last 5 to 10 years. It's 25 years since I started doing research into cardiology, and my interest has been since the get-go, looking at techniques with cardiovascular imaging to understand what's happening in the heart. I did a lot of work using ultrasound and to assess blood flow in the heart muscle tissues, and went on to use some nuclear medicine techniques and MRI to do that. Over the last 10 to 15 years, I've developed a significant interest in cardiac CT. The cardiac CT has really blossomed over that time because the CT scanners now are able to capture the image from the heart so quickly that we can get a detailed image of the heart and the coronary arteries as if the heart itself wasn't moving. We're able to assess the coronary arteries in fine detail, looking for evidence of blockages in the artery. And we're also able to look for plaque buildup, inflammation in the plaque, and also to understand the risk of a plaque in the heart, in the coronary arteries rupturing and causing a heart attack. So these research interests have now percolated through to my clinical practice. And every day we're using these techniques now to treat people, to avoid heart attacks, to avoid major cardiac problems. And this has been a great reward, I think, for all of us.